end of summer quarter, like the last week of summer quarter we were there, switched all of their pumps out to a completely different type of pump and tubing. So it doesn't really matter, the principle is the same. We want to make sure that we fill this tube full of whatever fluid we're putting into the patient so we don't put a bunch of air into them, basically. Again, I've told you guys before, if you can work your cell phone, you can work the pumps. Okay, they're a lot simpler. You can do all your fancy fun things on your iPhone or whatever. You can work these pumps. They're pretty self-explanatory. A couple of things that you'll need to know. So you need to make sure you have the right type of tubing. If you're working with a pump, you'll need tubing that has a pump cartridge on it. If you're not working, if you're just doing like a gravity drip, then there's a different type of tubing that doesn't have this cartridge. Okay, so just make sure that, and they're all usually in the IV stock room all bunched up together. So make sure you get the right type of tubing. The smaller one is secondary tubing, so it's going to be for anything that is not the main IV fluid that's going into the patient. Okay, so these are going to be like antibiotics. There may be some different meds that you'll put through as a secondary medication. Okay. When we talk about primary, we're talking about the main IV fluid that's ordered. So there are lots of different types of IV fluid. I think there should be a little chart on Canvas that talks about isotonic fluid, hypotonic, and hypertonic. So isotonic fluid is going to be pretty much anything it's just normal saline. There's D5W that is also isotonic, and LR is considered isotonic. LR stands for lactated ringers or ringers lactate. Doesn't cause any fluid shifting to go on. A hypertonic solution is going to be pretty much anything that has dextrose in it. So if you have something that says D5, D stands for the dextrose, 5 stands for 5%. Okay. So a D5 is going to be a hypertonic solution. D10, so again, dextrose 10%. Anything with D10 or higher, greater than 10% of dextrose, has to be given through a central line versus a peripheral line. We're just working with peripheral lines today. So as far, well, I guess it doesn't really matter because we're steam fluids. So anything with D10 or higher, just remember it's got to go through a central line. Okay. What else do you need to know? So a hypertonic solution is going to cause fluid to shift which way? If we've got an intravascular space, so all the blood vessels, we've got an intracellular space, and which way are we going to cause?
Intravascular.
So it's going to cause out from the intracellular into the intravascular space, because the solution we're putting into the blood circulation has a greater concentration, so we're pulling fluid from other areas of the body to go into the intravascular space, right? Mm-hmm. Okay. Correct me if I'm off. Hypotonic is going to pull fluid the other way from the intravascular system, or the vascular system, intravascular space into other areas of the body. Okay. So common names, you may see NS stands for normal saline. It's 0.9% sodium chloride, so it's basically salt water. About the same concentration as our blood. So it's going to be an isotonic solution. You may see a half NS, which is half normal saline. So it has half the amount of saline in it, or of salt. You may see a combination, so a D5 half NS. So it's dextrose 5% in a half NS, so it's going to be 0.45% NS. Right. So just kind of getting you guys ready, kind of getting used to the different types of names that you're going to hear. So D5 half NS, and you're like, what the world is that? Okay. NS, LR, just kind of become familiar with those terms and those names. What else? What do we need to know? That's about it. So the procedure for doing this, you're going to want to make sure you have the right solution. Oh, one more thing with fluids. You may also see fluids ordered with potassium in them, so with 20 or 10 milliequivalents of KCl. So your order may read D5 half NS with 20 of KCl. Okay, you're like, what in the world? So it's got 5% dextrose, 0.45% salt water, saline, and 20 milliequivalents of potassium. So the potassium is very dilute, and so it's going to be safe for the patient rather than giving potassium as an IV push, which could kill our patient. Okay? So again, if you see an order where there's potassium ordered on the IV bag, there will be a big red box where it will say either 10 or 20 milliequivalents of KCl, of potassium chloride. But it will be red box, so it kind of stands out. So when we are ready to spike and prime a bag of saline, you're going to make sure you have the right tubing. There's some information on your tubing. It will tell you how many drops per milliliter approximately. So this one is a 15 drops per milliliter. And I think that's about all that we're going to see. Some of the older tubing I've seen is like 10. And you may see a micro drop tubing, which is 60 drops per milliliter. So it's given really teeny tiny little drops. So you'll see that on there. It will give you a nice diagram of what your tubing looks like. So you've got a piercing pin, you have a drip chamber, the cartridge, and then a couple of ports to hook syringes to give meds. So, you know, that's your info on this bag. As you grab your IV bag of fluid to hang, it will tell you what it is. It will have an expiration date on it. It will have a lot number. It will tell you how much is in it. It's got a barcode, so everything, as you guys have probably seen, is barcoded. You scan the patient, scan the med. Okay. And they come in all varieties of sizes. If we're hanging this as a primary bag, it's usually going to be a 500 or a 1,000 milliliter bag. So in order, I think, honestly, one of the things that people have the hardest time with is opening these little bags. So look for the notches on the top and pull straight down. Okay? Give it a good tear. If you're timid with it, it's not going to open. Okay? So you get mean with your packaging. That's half the battle. So now's the easy part. We've gotten it out of the package. Okay? Same thing with this little guy. There is a serrated edge here. Okay, don't be trying to break it open. It's all ready for you to open up nicely. Okay. Yay. All right, so we're ready to spike and prime our bag. This is pretty much all we're going to need. I like to do this in the med room, just so I'm not in front of the patient. There's a sink, there's a garbage can, whatever you need. We're going to drip into our garbage cans today. Okay. The important part of this procedure is keeping this piece sterile. Okay, this piece right here, it's got a cap on it. This is the piece that's going to go into the bag. We don't want it to touch anything before it gets in there. Okay. Your bags will look different. Some will have different types of little stoppers here. Some just have like one big round white one that you just pull out. So what you're going to do with this is just pull the end out. You want to keep this part sterile too, which I just didn't. Make sure that we get our cap off, and you're just going to go straight down into your bag. Usually requires some twisting, okay? Twisting and turning to get it down in there. You want to make sure that you're going straight down, otherwise you can poke through the sides of the little piece right here and it will drip. All right. So we have gotten it in there. We spiked the bag. Okay. And to prime it, usually just like once it's there, you can just hang it up, and then you've got two hands to do what you need to do. The other piece that we need to be careful about is our end piece. This is the piece, man, I'm making a mess. This is the piece that's going to be hooked onto the patient eventually. Okay, get it all unwound here. it has a cap on it. So we want to leave that cap on as long as we can. If we need to take it off, we just want to make sure that we don't set it on the bed or drop it into the garbage can or whatever. Once we have our tubing into our bag, we're going to squeeze our drip chamber. You guys can see over there. Squeeze your drip chamber. There's a little line on the drip chamber. You can squeeze it about up to there. It doesn't have to be perfect. It's okay if it's a little more or a little less. You just want to have some fluid in this drip chamber at all times. Okay. For these particular, holy cow, this is really twisty. For this particular tubing, what you're going to do is start, we've got a white cap here. We're going to start with the white cap down or upside down. Okay, so a couple little pieces on here. You've got, this is a place where you would hook a secondary IV to. It's got just kind of a rectangular-ish chamber right here, and then a round chamber. So we're going to start with this upside down. In order to get my fluid to start running, all I need to do is pull the white round piece on the back and just pull it straight out. You don't need to twist it or turn it or anything, just pull it straight out. You can see that my fluid has started dripping, and I'm going to watch it. So it's going to come down through my tubing. As soon as it fills up this rectangular chamber, I'm going to flip it right side up, and then it will continue to prime. We're watching out for little bubbles as we go along. Okay. Gravity's your friend. If I hold this up higher, it's going to stop dripping. If I hold it lower, it's going to keep dripping. I'm going to let that go as far as I can. Now I've reached a point where it stopped dripping, and I'm still open. At this point, I'm going to need to take this end cap off because it's nice and it's got a vacuum in there. So if I take my end cap off, it's going to continue to drip. I'm just going to hold that and just let the fluid run through until I get most of these bubbles out. All right. Now, patients, for some reason, think that if any air gets into their body, they're going to die. So we want to get the bigger bubbles out. Tiny bubbles are not going to hurt your patient. Okay? Something like this is not going to hurt my patient. However, it might freak them out, so I'm going to do my best to get the bubbles out as much as I can and let them know that tiny bubbles won't hurt them. They have dissolved gases in their blood, which are tiny bubbles. Okay? So I can see my fluid. I've spiked my bag. My tubing is all nice and primed. And I'm ready to hook it up to my patient. I'm going to go ahead and, if I'm in the med room, I will get a sterile cap to put on here. So I'm going to pretend this is my sterile cap. I'm going to put that on. Take this into my patient's room. I've got an IV pump ready to go. In order to load these up, you want to load it with the white round piece facing the back of the machine. Okay? And there's a, you guys can come over if you can't see. I feel like stretching it as far as I can here. You'll pull the lever up to open the front door, and then this piece just kind of slides in. There are a couple of guide areas right here, and so if you kind of put it in at an angle and slide it in, and then close it, it will load it up. I can either set my pump first or hook it up to my patient, whatever you want to do. I usually will hook it up to my patient, that way I don't forget to do that, because once I set it, I automatically hit run. So I'm going to hook that up to my patient, and now I need to set the pump. There will be an order for the rate. Your IV rate is always going to be in milliliters per hour. Okay. So I turn my machine on, and it runs some self-tests, takes a minute. Tell me here in a minute, it will say, give me option A or option B. Option A is for my primary tubing, or for my primary fluid. So whatever my main fluid, this is LR, so my order is for LR, maybe to run at 125 milliliters per hour. So my options here, I have rate and volume infused. If I press A, it will give me rate VTBI, or volume to be infused. I think on the old ones it might be VTBD, volume to be distributed. So something with a V means volume. That's the total amount. And then the time. So you can set this a couple of different ways. As long as you have 2 of the 3 pieces of information there, the other one will automatically set. So if I have to give a certain amount, a certain volume over a certain amount of time, I can set my volume and my time. It will automatically set the rate. If I know that I have a continuous, that the rate's going to be running at 125 milliliters an hour for ever and ever till the doctor says stop, I can set my rate and my volume. Okay. So rates, we'll say 125. We've got a nice numerical keypad here on this pump. Some of our older pumps you guys will be using have, it's a dial type of mechanism here, and you'll use the arrows to go up or down with the numbers. So I'm 125. I can use my up or down arrow, so I'm going to press my down arrow to VTBI. That's the volume that's in my bag, or the volume that needs to be given to the patient. If it's running continuously, I'm going to set it for whatever volume is in my bag. I know I have a 500 milliliter bag, so I can set it for 500 or a little bit less. You don't want your bag to completely empty because it just causes a big pain with your tubing. Once your drip chamber doesn't have anything in it, then you basically have to unhook everything from your patient, reprime your tubing. So as long as you can keep fluid in your drip chamber, you can just change the bag out. Okay. So I've got 500. I'm going to set it for about 450. Also a mental reminder to myself that I need to go in and check it. Okay. And that tells me it's going to run for about 3.5 hours. And then I can just go ahead and push start, and I don't want it will drip all over. If I push start, it's going to go ahead and start running. You'll see this little light will start beeping, or start blinking, and I already have a distal occlusion because I have the cap on. Okay, I take my cap off, start again, there we go. So your machine will tell you if there's a problem. Sometimes it will tell you there's a problem when there's not a problem. If you're giving a secondary med, so maybe an IV piggyback antibiotic, or some other medication that is not the primary fluid, again, you've got your tubing. The tubing looks a little bit different. It's going to go through the pump, but it doesn't have the cartridge. So it's going to hook in to this piece of the cartridge. So it will be running through the pump also. In order to use anything with a roller clamp down closes it. Okay, roller clamp up. If I just spike my bag with my roller clamp up, my whole bag's just going to whoosh through and empty. So you want to make sure you start with your roller clamp down. You're going to do the same thing to spike and prime this. Okay. Get a little bit into your drip chamber. Now, with your medication, we don't want a bunch of this to drain out into our garbage because our patient needs it, right? So you want to be a little bit more careful when you're priming your secondary bag. And you can control it with your roller clamp pretty well. Again, I just leave that end cap on unless I have to take it off. And if I just move my roller clamp up a little bit, you can see it's priming through. I can control the rate that it goes through. Got one little bubble at the end. I might be able to get out. Okay, so as soon as I get to the tip, I want to close it off because I don't want to lose any of my medication. This piece is going to hook in to your cartridge. Now, a lot of your cartridges have a blue clave on here, so all you need to do is clean it off and attach. These ones do not, so I'm going to use my 4 hands. Hook that in right there. Okay, so now my secondary is hooked up. In order to set my secondary, I'm going to go through the pump again, but I'm going to set my secondary as B. On these ones, you have an option of pri or sec, so primary or secondary. So I've got this ready to go. I want to make sure that my roller clamp is open because I want this medication to get into my patient. Shut it off. So I'm going to clear my settings. I'll set my A, my primary, set for 125. Got 450. Okay, so my primary is running. I want to set my B now, so set my piggyback. It will give me options. I can run it as piggyback, and if I do change mode, I can run it as concurrent or piggyback. Piggyback basically means that it's going to stop the primary fluid and only the secondary fluid is going to run through. If I run it as concurrent, they're both going to run through together. Okay. So I'm going to run this as a piggyback. Your drug book should tell you administration time, or the pharmacy, whatever IV piggyback you're giving. If it's an antibiotic, it will say, run over 30 minutes or infuse over 1 hour. So it will usually come in a smaller bag, either a 50 ml or a 100 ml bag. All right. So a couple ways you can set your IV piggyback. We know how much we have and we know how long we need to give it. So if you don't want to figure out the rate, I know I can just skip down over rate. I know that I have 100 mils in my bag and I need to give it over 30 minutes. Okay, so what do you think my rate is going to be? If our rate is always in milliliters per hour, I have to give 100 milliliters in half an hour, so what's my rate? 200. Great. Does that make sense? So I'm giving the same amount of volume, but in half the time, so my rate's going to be double. Kind of, sort of? Okay. We can do this in our individual labs if we need to figure out rates. But on this lovely machine, okay, I know how much I need to give and how long, so it automatically sets my rate for me. Okay. And so once I put